Physiotherapist Dr. Nicole Fote said the outbreak of the Guillain-Barré Syndrome placed a massive strain on the health system. Although Grenada was considered fortunate as compared to other regional countries, the island saw 9 cases of the Guillain-Barré Syndrome, of which 2 patients died as a result.
As we had experienced it, it was quite a shock for us to deal with so much at such a short time. We are used to having patients, probably 1 or 2 every 2 to 3 years. But this time we had 9. We had 1 person in June, we had 1 person in July, we had 5 in August, and we had 1 in December.
Dr. Ford said the medical staff at the hospital was forced to respond effectively.
It was quite a strain on the intensive care because they all had to have intensive care approach initially. And that means that we had to make sure and ensure that everybody had mechanical ventilation and physiotherapy rehabilitation from day one to prevent lots of other complications which may come through, meaning deep vein thrombosis, because they were all flaccid paralysis patients who were not able to move or to do anything for themselves. Starting from the face, there were difficulty closing eyes, getting words out properly, and turning in their beds also. So we had to do everything for them in terms of rehabilitation.
Meanwhile, PAHO and the WHO is currently holding a 2-day workshop at the Radisson Beach Resort, focusing on the rehabilitation of patients suffering with the condition. Dr. Jean-Marie Rwanga-Woba said at the end of the workshop, it is expected that the regional approach can be taken in managing the condition.
We had a discussion about really the coordination issues. We have many partners, government, private, who are doing rehabilitation services. But we need to bring everybody together, so we need to be better coordinated. We have issues of capacity building that needs to be taken into account as we move forward in terms of our planning.
Currently engaged in training of various health practitioners from 9 countries around the region. Miguel Payne for GBN News.